part of the patient education series, I'm going to talk on stress test that we do for the blockages in the heart. Now, when we do a resting ECG, it is a screening test, but we are not able to find out if there are any minor blockages in the heart. Only if there has been a previous heart attack or if there is an ongoing heart attack, that will be seen by a ECG. So to see the blockages in the arteries of the heart which are not of very high grade, that is blockages which are not 100%, for them we have something known as stress test. Now basically what stress test means is we put some stress on the heart, and that is by increasing the heart rate by various means, and during that stress we visualize the functioning of the heart or the ECG of the heart. So a very simple method to do that is what we call as treadmill test. Now in this we make the patient walk on a treadmill, and because of the exercise the patient's heart rate increases. Now when we have reached a set target heart rate which is decided based on the patient's age, at that point the continuous ECG monitoring is being done for the patient while he is exercising, and we look for any changes in the ECG which were not present when the ECG was taken at the time of rest. Now if there is any blockage in the arteries of the heart, then during exercise the blood which is passing through that blockage is not enough to supply the enough oxygen to the heart. Now because of this there will be changes in the ECG which are not seen when the patient is resting. So this is the simple test what we call as treadmill test. Now a modification of this treadmill test is, which is more accurate than the treadmill test, is something known as stress echo. Now in stress echo we do a baseline echo when the patient is resting, and we see how the heart is functioning. And after that we make the patient exercise, we reach a target heart rate, and then we check the echo again during that phase to see if any part of the heart which was functioning normally at rest is not functioning properly at the time of increased heart rate. If there is a decreased blood supply to a particular portion of the heart, then that part of the heart will not work at the time of exercise. So this is the way to find out blockages in the heart which are not seen in a resting ECG. Now both of these procedures are very simple procedures. They are non-invasive, they are absolutely painless. The only thing that is done is that some ECG leads are connected onto the chest wall, and the patient is made to walk on a treadmill machine. It is not even running, it is walking. Most of the times the test is over within 6 to 7 minutes. Sometimes it can go up to 8 to 10 minutes. The overall process may take a complete time of 10 to 15 minutes. So these are very good screening tests for patients in whom we want to find out if there is any blockage in the arteries of the heart.